Are you dealing with flat feet, fallen arches, or overpronation, and you've been told that your only option is orthotics or surgery? Hi, I'm Amin Ibrahim, your physical therapist, and in this video, I'll walk you through proven clinical strategies to address flat feet without surgery or gimmicks, using the same techniques I use with my patients every day. We'll cover how to assess your own arch mechanics, the actual cause of flat feet most people miss, and the PT-based exercises and daily changes that rebuild your arch system naturally. Let's get into it. Flat feet or pes planus refers to a diminished or collapsed medial longitudinal arch. Most common are flexible flat feet, meaning you have an arch while sitting or non-weight bearing, but it collapses when standing or walking. This isn't just about how your feet look, it alters the entire kinetic chain. More internal tibial rotation, medial knee stress, pelvic instability, and compensatory lumbar extension. In PT, we don't just treat the foot, we address the entire system. Flat feet often develop due to a combination of foot intrinsic weakness, for example lumbricals and abductor hallucis, poor posterior chain control, like glutes and deep core, inability to control pronation or supination dynamically. So orthotics may support, but they don't restore function. As PTs, we train the system. Let's quickly assess your foot mechanics. Stand barefoot in front of a mirror and check 1. Do your arches collapse when weight bearing? 2. Can you create an arch voluntarily? 3. Does your knee drift medially when you squat? And 4. Check your big toe extension. Can you reach 60 degrees? Write down what you notice. This becomes your baseline. And now, the 3 pillars of physical therapy for flat feet. 1. Mobility. Restore range of motion where it's lacking. Let's start by freeing up motion, especially at the ankle and big toe. Exercises include gastrocnemius stretch. Emphasize both knee bends and straight variations. First MTB mobilizations. Use hands or band to restore toe extension. Foot rolling. Lacrosse or golf ball under plantar fascia. 1 or 2 minutes each foot. Talocrural joint mobilization. Band distraction. Improves dorsiflexion. Clinical tip. Limited dorsiflexion leads to early pronation. Fix the ankle and the arch has a fighting chance. 2. Strengthening. Build active support. Now we retrain the muscles that create and control the arch. Foundational intrinsic exercises. Short foot. Teach arch lift without toe curl. Progress to standing, then single leg. Toe yoga. Alternate big toe up, others down. Targets neuromuscular control. Doming plus heel raise combo. Combine each formation with calf activation. Kinetic chain. Banded clamshells. Target glute mat to reduce knee valgus and foot collapse. Step downs. Control knee alignment and foot arch during eccentric load. Single leg balance plus reach. Train proprioception and postural control. Clinical tip. Pair foot strengthening with glute medius activation for global alignment. 3. Motor control and gait re-education. Strength without control equals poor outcomes. Let's retrain how you move. Drills include a slow motion gait practice, Q tripod foot, heel, base of big toe, base of pinky toe. Marching in place barefoot, reinforce foot placement and hip control. Mirror feedback, train visual awareness of knee and arch position during mini squats. Daily habit changes. Daily habit changes include go barefoot or use minimal footwear during home and easy walks. Avoid prolonged time in rigid shoes. Q clients. Lift through the arch. Stack the joints. Foot, knee, and hip. You're not going to fix flat feet overnight, but in 6 to 12 weeks of consistent practice, you can improve arch activation, reduce pain and fatigue, restore functional alignment. Start with 10 to 15 minutes daily. Track your progress and build from there. This is true corrective exercise, not a quick hack. So, can you fix flat feet naturally? Yes, with the right strategies. As a physical therapist, I've seen this work again and again with patients who were told they had no options beyond surgery. If you want a guided flat foot rehab, drop a comment below. Like, comment, and subscribe for more evidence-based rehab content from a physical therapist who keeps it real. Your foot are your foundation. Let's rebuild them, one step at a time. See you in the next video, and goodbye.